Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about methamphetamine. In 1995, there were 6 methamphetamine lab seizures in the entire state of Indiana. In 2015, there were 1,530 in Indiana and 4 just in Johnson County. Methamphetamine is a highly addictive central nervous system stimulant. Some common names include speed, chalk, ice, crystal, crank, glass, and meth. It is very dangerous as it speeds up the heart and blood pressure to uncontrollable levels. It also releases dopamine, which is the pleasure chemicals. It gives user that high feeling. They may use meth for days at a time while not eating or sleeping. The meth binds to dopamine receptors, so while the meth is broken down, the dopamine is too. After the meth wears off, the dopamine chemicals are very low and the person crashes. They then need more meth to experience the pleasure and may feel depressed. Meth is used by smoking, snorting, skin absorption, ingestion from hand to mouth, and injecting the dissolved powder. Methamphetamine is inexpensive to make using common over-the-counter supplies. It is a mixture of volatile substances, including solvents, such as paint thinners and antifreeze, corrosives, such as ammonia and lye, reactive metals, such as mercury and lithium, and ephedrine or pseudoephedrine, which is over-the-counter cold medicine. Methamphetamine manufacturing and smoking produces an off-gas residue and creates deposits that are left behind indefinitely on walls, ceilings, floors, especially the carpet, doors, cabinets, furniture, especially the upholstery, plumbing, and the HVAC system. It produces about 6 pounds of waste for every 1 pound of meth produced. The remains can reactivate if they are disturbed. Those who are most at risk from exposure to methamphetamine include law enforcement, first responders, those who are immunocompromised, pregnant women, senior citizens, and children. Children are rapidly growing and spend approximately 80 to 90% of their time indoors. They have a higher rate of oxygen consumption per unit of body weight and have narrower airways. They are especially at risk from ingestion due to often putting their hands in their mouth. They are at risk from injury from fire, explosions, poisoning, and abuse or neglect. Some common behaviors from methamphetamine users include hyperactivity, compulsiveness, aggression, violence, paranoia, hallucinations, restlessness, agitation, dilated pupils, and being very talkative. It only takes a small amount of methamphetamine exposure to create adverse health effects. Some acute health consequences include dizziness, lack of coordination, headaches, nausea, vomiting, confusion, shortness of breath, cough, chest pain, and chemical irritation or burns to the eyes, skin, nose, and mouth. Some health consequences from chronic methamphetamine exposure include respiratory irritability, disorientation, such as confusion or hallucinations, behavioral changes, such as anxiety, violence, and paranoia, neurological damage, such as reduced coordination, impaired learning, or Parkinson's disease, liver and kidney damage, infectious diseases like HIV, hepatitis B, and hepatitis C from injecting the drug, extreme weight loss from not eating, meth mouth, skin sores from scratching, birth defects, cancer, and death due to overdose, stroke, heart attack, and organ problems. The priority for treatment for methamphetamine is to treat the complications from overdosing. There are no approved medications for methamphetamine addiction, although some medications are used off-label. Cognitive behavioral therapy has proved useful for those returning to normal life. Some studies have found that providing incentives helps as well. Withdrawal symptoms include anxiety, fatigue, severe depression, psychosis, and intense cravings. Meth labs may be found anywhere, including houses, apartments, hotel rooms, motel rooms, mobile homes, restaurants, sheds, motor vehicles, outdoors, and even in churches. There are many ways to identify methamphetamine labs. One way is by the odors, which may be described as being strong and irritating. They may be sweet and ether-like, such as in a hospital odor, or ammonia-like, which may be similar but much stronger than wet diapers, fertilizers, and glass cleaners. There may be unusual security or ventilation, such as baby monitors or video surveillance outdoors, elaborate fencing and heavy-duty locks, ventilation fans, night vision equipment, protective aggressive dogs, windows blacked out or covered, weapons, and booby traps. There may also be a large amount of ingredients, including cold and allergy medicine, anhydrous ammonia, lithium batteries, gas line additives, table or rock salt, sidewalk deicer, drain cleaners containing lye, starting fluid, camping fuel, matchbooks, iodine, acetone, brake cleaners, ether, sulfuric, muriatic, or phosphoric acid, rubbing or isopropyl alcohol, red phosphorus, glass containers and cookware, plastic or rubber tubing, funnels, propane tanks, coffee filters, camp stoves or hot plates, kitty litter, and hydrogen peroxide. There may also be large amounts of trash both indoors and outdoors, including reddish-stained coffee filters, jars with multicolored liquids, aquarium-like clear tubing in bottles or jugs, battery casings, burnt foil, and light bulbs without filament. There may also be increased activity at the site, unusual structures, and renters paying in cash. Use extreme caution when visiting a suspected methamphetamine property. Park in sight of the home in a well-lit area, but not in the driveway so that you may not be blocked. Do not be distracted, as with a cell phone. Remain close to the door, not obstructed by a person or by furniture. If you are sitting, sit in a hardback chair, not upholstered furniture. Be sure to have an excuse to leave prepared. Be aware of any unusual behaviors. Do not touch any suspicious items inside or outside, and leave as soon as possible if you smell chemicals. The main respondents in seizing and cleaning methamphetamine labs include the Indiana State Police, or ISP. Initially, the local police may respond, and then they contact ISP. ISP removes the bulk chemicals, reactions, and things posing immediate threats to the public and environment. The local health departments ensure the contaminated property remains vacant until clean. The Indiana State Department of Health regulates the process to turn contaminated properties into clean properties, and they train and oversee the qualified inspectors. The qualified inspectors, or QIs, test, clean, dispose of waste, retest, and certify the properties as ready to be occupied or sold, and they must be on the Indiana State Department of Health's list of qualified inspectors. Sometimes the Department of Child Services, or DCS, is involved in the removal, placement, and follow-up care of children in the home. Here is a chart of how the process works when the meth lab is seized. The Indiana State Police seize the meth lab and notify the local health department. The local health department then orders the owner to clean the property and issues an order to vacate, which remains in effect until this is done. Then the owner has two options. They may choose to have the property demolished and the waste is properly disposed of. They then will receive a notification of demolition, and then the property is cleared. Or they may hire a qualified inspector to do an initial assessment. The qualified inspector may test, or the owner may assume that the cleaning needs to be done, and they just start forward from there. If testing is done and it is below the allowable limit, they will then receive a cleanup certificate, and the order to vacate is removed. If the testing is above the allowable limit, decontamination is done. The home is then retested, and if it is still above the limit, it is recleaned and retested. Once all samples are below the allowable limit, they will then receive the cleanup certificate, and the order to vacate is removed. When children are found at the site of a meth lab, they are removed with only the clothes on them. They are not allowed to take any other clothes or toys. Medications may be taken in a sealed bag. They then have an initial medical assessment to determine if they are stable or in need of emergency care. A urine sample is needed within 12 hours. They then go through decontamination and photography. They shower and change their clothing, and pictures are taken to show their cleanliness or injuries. An interview is then conducted at the scene, and a follow-up is done within 48 hours. This is to determine their circumstances and lifestyle. They are then transferred, and the Department of Child Services decides whether they go to other family or to emergency shelter. Nothing from the home is going with the child. As far as follow-up, they then need further medical evaluation, and the Department of Child Services determines when or if they are returning to their parents or their home. Residue from methamphetamine labs is left behind indefinitely. It doesn't just clear up with time. And it is not just normal housekeeping that is used to clean up the property. Cleanup is required if the methamphetamine level is greater than 0.5 micrograms per 100 centimeters squared. The final decontamination standard in Indiana is 0.5 micrograms per 100 centimeters squared per 318 Indiana Administrative Code 1. It is very costly to clean up a methamphetamine lab. The homeowner is responsible to pay for the testing, cleanup, demolition, or decontamination. It can be thousands of dollars for the testing and cleanup, and may be up to $10,000. You should check with your homeowner's insurance to see if this is covered. It can also lead to lost rental income if it is a rental property. It leads to reduced property values and compromised health. The owner may choose to decontaminate, remove all potentially contaminated materials, or demolish a property, all under the supervision of a qualified inspector. So what can you do? You can create Neighborhood Watch, and if you see something, say something. Do not act alone. If you see something suspicious, call law enforcement. Here is a screenshot of the Indiana Meth Lab locations map. You may find this map by going to the website www.in.gov/meth/2371.htm. This concludes the methamphetamine presentation. At the bottom of the screen, there are links for the interactive Meth Lab map, as well as a video about meth and dopamine effects and a Meth Lab explosion. If you have any questions, feel free to contact your local or state health department or visit any of the links available on here. Thank you.